Now, let me ask you a question. There's something called the Dexa scan. Can you tell us what that is, and is there radiation involved, and should patients be worried about that?
So the Dexa scan is what we commonly refer to as the bone density test. Okay. So it is the only way that we use to detect bone density and to determine if a patient has osteoporosis. It can also help us determine if the bone health is normal, so the density is normal, or if a patient has what's called osteopenia, which is not quite osteoporosis, but on the way there. And the radiation is actually very small. In fact, they say it's equivalent to your environmental exposure for the day.
Okay. And you just mentioned something, let me follow up. You mentioned osteopenia. You're not quite at the osteoporosis level yet. So if you do discover a patient might be suffering from osteopenia, what can kind of be done to hopefully prevent them from developing osteoporosis?
Great question. And in that case, I do see a lot of patients who have osteopenia, and I do advise them, if they haven't already, to optimize their diet intake of calcium and vitamin D. If they haven't already, to incorporate bone weight-bearing exercises, to stop smoking, to reduce alcohol consumption, and also, very importantly, to make sure that they are being careful of their surroundings and protecting themselves from a fall. Fall precautions are exceedingly important to discuss because most of us don't have enough time in the day, or nowadays multitask and walk around with our phone and miss a curb. And that's not a great way to find out that you have osteoporosis.